right, all right, all right, all right, all right, all right, all right. We are on the Life and Health Show on a powerful show today. And in the before you do that, as we wait for you to do that, how was your week, honey? How was your week?
Yeah, it wasn't bad overall. I think it was very productive. Work and in and out, nothing outstanding,
Wow.
but it was productive. I would say that. Yeah.
Productive, that's what we want to hear, right? That's all we need. Productive. Life is there and health is there. So that's the most you can ask of God anyway. All right. So our guest today is Dr. Nathan Nartey, who happens also to be my spiritual father because he's the presiding elder of the church that I go to. And so, he is a busy man, focused on his family as well as, his practice as a physician and then also spiritual physician. Oh, come on, man.
We are blessed. We are
We
blessed.
are blessed to have him, So if you have any questions relating to, cardiovascular health, in particular with hypertension, this is the man to ask on the live today. And also, if perchance you are just bored of hearing us talk about health and you just want to hear something about health and you want to, spiritual thing too, he is here to help, my goodness. And so hopefully we will enjoy our time together. So I'm going to bring him on the live and then give him the chance to also say a couple of things about himself before we move forward. And with that, I want us to welcome our man of the day in the person of Dr. Nathan Nazi. Come on, give him a round of applause. My goodness. All right. That is how we have been tracking you for a while, getting you on here because you are a very busy man. But we're excited because we know you have a lot of good stuff to share. So tell us a little bit about yourself, Doc, and we'll move forward with our questions about hypertension.
Yeah, so as you said, my name is Dr. Nan. Currently, I am internal medicine by profession and by training and specialty, and also currently I'm involved in rehab medicine and a medical director of the medical rehab unit at Hospital for Special Care. So that's the full-time job that I do now at Hospital for Special Care, taking care of people. So I see in true time post-hypertensive complications and the consequences of it. So that's what I do now. Married man, two lovely kids also, and as my brother said, I'm also a presiding elder by my other profession.
All right, all right, all right. All right, Doc, you are welcome to the Life and Health Show. And as we said, we are excited to have you here with us. And we're just going to have fun, even though we're going to talk about some serious stuff. But I think it's all going to be fun. So let's all relax. And then if you have any questions, if you are joining and you want us to answer any question about health, in particular with a subject of hypertension or anything about cardiovascular health, this is the time for you to put that up and write it down maybe in the comment section, and we would be able to ask Doc while he's on the live. And even after the live, if you watch us after the live, because a lot of people watch after we have closed, and you have a question, I'm pretty sure he will be willing and able to go through the chats and comments and answer any questions that you may have. But we want to say thank you and welcome to the Life and Health Show. Your first, but the beginning of many. Oh, man. All right. All right. So, as we said, we're talking about the silent killer, how hypertension affects your body. And with that being said, we are going to zoom straight to questions and hopefully move forward. Even before we go to any question, Doc, what can you say about hypertension, just in general, just to get the ball rolling before we get specific?
Sure. So hypertension, it's common. That's what I would say. Hypertension is more common than we think. Number one. Number two, as African Americans, as Africans, hypertension is more prevalent in us than you would see in Caucasian. So we have to be extra attentive to that. And hypertension is very treatable. That's what I really want to get across today, is that it is treatable. And by God's grace, there are so many things we can do to treat hypertension so that you don't have the adverse effect from it. But the main point is that hypertension is very common. There are a lot of people walking around with it right now, unfortunately, and they don't know. Secondly, hypertension is more prevalent in Blacks, in Africans. And then, as I said, it is so treatable.
All right, all right. That is very important to know. So it's common but treatable. So that is a good thing to know, because sometimes, we hear of something and you think there's no way out. But the positive thing that I get from this is, no matter how common it is still something that we can manage. So I think that is a good
Yes.
thing to know. All right. So with that being said, we're going to go straight to our first question. And our first question is, actually, we have an intro outline. Our outline is we're going to talk about uh, hypertension. He's already done that. And then the next one is we're going to be doing the interview portion, where we're going to be asking Dr. Nartey about some specific questions relating to hypertension. And then from there, we will try and see if we can answer some viewers' questions, and hopefully, if we exhausted everything, and if there's no viewers' questions, we'll go to his final thoughts and our final thought, and then we prelude next week. All right, so that is how our show is going to be like. But again, we would like you to share your comments, share the show, and make sure you invite somebody, because this affects a lot of people. In fact, especially as he said, if your skin color is like mine, you are most likely going to see somebody who is, and as a matter of fact, it's not just us now, because of how the diet and lifestyle is now, everybody is affected. So share the stream if you are interested about hearing more, or somebody that can benefit from this talk about hypertension. All right, so with that being said, our first question is, go ahead, I've talked too much.
Yeah, so I think we want our discussion to be as interactive as possible. So we'll be looking out for comments or anything. If you are watching us, just say hello, hi, so that we know that we have audience that are watching us. We want it to be interactive. So if you have anything to bring up, any specific questions, don't hesitate to put in the comment section.
All right, go ahead with the first question.
Okay, so the first question: how does hypertension silently damage the body without symptoms?
Yeah. So one of the good things about the body is that it is adaptive. And as the body is able to be adaptive, so is hypertensive a silent killer. So as the blood pressure rises, the cardiovascular, which is your heart, will modify, will try to adapt to it. But at the same time, the damage is being done in the blood vessels and also what we call the end organs. So pretty much, as blood vessels start from the heart, they are big, and as they go, they get smaller until they get to the tissues when they are very tiny. And with high blood pressure, this affects those blood vessels. And then when it affects them, in the beginning, they will modify to try to compensate for the high blood pressure. And that's why you would walk around no effect. But a matter of time, that's when you're going to see it. So that adaptive modification ability of the heart and then the cardiovascular system is what makes it a silent killer, that you are not aware of what is going on. It's not like when you hit your thumb and it hurts right away, so you can just go, oh my gosh, it hurts. But because of the adaptive nature of the human body, the blood vessels would change. They will conform to the high blood pressure, and then by the time we realize, it might be a little bit too late. So that is the adaptive nature of the adaptive nature of the body leads it to be a silent killer.
Wow. That is huge. Now, um, Why then? That's a follow up to that question. If the body adapts like that, why is it that still eventually the body allows these organs to be destroyed? I know that. Yeah, if you can say anything to that, why is it that it doesn't have
Yeah.
any serious preventative things to make sure it doesn't end up, with the end organs like
Destroying.
you're saying? Yeah.
Yeah. So the body tries. The body tries, but there's so much it can do.
Mm.
And one of the things that happens with high blood pressure is that most of the time our arteries are the ones that are deeper in the body. What you see on the surface is what you call the veins. So the arteries are buried deeper, and those are the ones that we when we check blood pressure, we check. And the arteries carry blood at higher pressure. So the arteries, one of the things that happen is that the arteries in our body will get thicker because the arteries will conform, will try to adapt to that. And as it gets thicker, then it can affect the flow. So if you think of a pipe, and then the pipe starts off like that, and the pipe gets thicker, in terms of the outer diameter of the pipe gets thicker, that can definitely affect the flow. So as the pipe gets smaller, 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 smaller into your kidneys, then that is how come you end up with kidney disease. As the pipes get smaller, smaller, smaller into the brain to supply the end, which we call the end organs, the brain, that is how come you have those damage. And as your heart conforms to the high blood pressure, the heart becomes thicker. And then that is how come you get all those complications from it. So the body does its best. The body does its best to adapt, but there's so much it can do and for so long. So that is what happens.
Wow. Wow.
So that make a very dangerous disease because it's very silent and you don't feel it.
Yes.
You don't know that it's going on in your body, and
Yes.
it may damage your organs
Eventually, yeah.
eventually. Yeah.
Prevention. Yes. Yes. So that's the one thing about hypertension. Unfortunately, you would only realize some people are hypertensive when they show up in the emergency room with an intracranial hemorrhage or bleed. That is the sad part about it. But yes.
Wow, my goodness. It's it's a sad thought, but we still need to clap. All right, let's move on to our next question. And I know some people are watching. Our brother Wilfred is watching. He says productive. He says productive. Thank you, Wilfred, for saying that. All right. All right. Now let's move on to my next question that we have for Dr. Nartey. And our next question is, read that. This is, what are the first signs of organ damage from hypertension? And in particular, what organs are involved? What parts of the body are usually seen?
Okay. So the number one of the first organs that is affected is the kidneys. So unfortunately, with kidney disease, also when it starts, we have different stages of kidney disease. When a kidney disease starts, you might go a while without not even knowing that you have kidney disease until so there are patients that come, and then on a routine blood work, we realize that their kidney numbers, one of them called creatinine, and other is called BUN. You realize that they are elevated. That's when you know that kidney disease is starting. So unfortunately, kidney disease also, so stage one, stage two, you might not even know you have it until some blood work will reveal it. So the kidneys are one of the ones that are affected. And by the time you realize the patient is almost at a stage three kidney disease, so that's one of the organs that is affected with high blood pressure. I talked about brain, so I'm just going to make it simple: kidneys and brain. And then with the brain, somebody will come in with a stroke. And then with a stroke, it could be from a bleed, or it could be from the damage of the blood vessels from high blood pressure, leading to lack of blood flow, which is what causes strokes. A stroke is as simple as the part of a brain not getting oxygen, not getting blood supply anymore. And it can be from a bleed. When you bleed in the brain, it pushes on things, it pushes around it. The skull is so thick, and there's not enough space anywhere for extra fluid. So when you bleed, somebody will come in with weakness on their side. So one of the first things we do is whether this is a bleed or what we call ischemic stroke. That means that there is a blockage. The third thing that hypertension also affects is that your heart. So hypertension leads to, if you think about it, the heart is a muscle. And if I go to the gym and I lift 10 pounds, my biceps is going to get bigger, right? If I continue to do 50 pounds, my biceps is going to get bigger than when I was doing 10 pounds. So that's the same way. The high blood pressure forces the heart muscles to modify and then to push against that pressure. So you realize that the left heart gets thicker. And as the left heart gets thicker, there are complications that comes with it, which is what we call heart failure. That means that the heart is not able to pump like it should. So if you have blood that is returned to the heart, it's not able to pump all of it. And then sometimes that can back up into your lungs. The other thing also that high blood pressure does is that we realize that people with high blood pressure are more predisposed to a condition that we call atrial fibrillation, whereby the heart beats out of rhythm. So normally the heart beats up, down, up, down, up, down, up, down. With atrial fibrillation, you have the heart more quivering. And as it quivers, because of the modifications that has happened as a result of high blood pressure. So high blood pressure, it can lead to atrial fibrillation, and atrial fibrillation leads to clots. So instead of the blood pumping, the heart pumping, and it quivers, we have something we call an atrial appendage that can form, and that clot can travel to your brain and cause a blockage downstream. So those are the other in terms of cardiovascular effects of high blood pressure. And then also your vision. High blood pressure can affect your vision. And the same way I talked about it affecting the blood vessels. Our eyes, we have blood vessels. It goes all the way to tiny blood vessels inside our eyes. And that pressure can damage the blood vessels. And then now you have difficulty with seeing. So those are the things that high blood pressure can affect, those organs that it can affect.
My goodness, that's a sad case, man. My goodness. That is a sad case. Wow. That is a lot to take in. It looks like we take high blood pressure, not so serious. From what you are saying, it actually is a serious thing. It is
Yes.
very,
Yes,
very,
it
very
is.
serious.
It is.
It is.
It is.
We,
And
we, we have to
unfortunately,
be.
as we are talking right now, some people are on a ticking time bomb, unfortunately,
Oh my
as we are
goodness.
talking right now. Someone is watching who potentially
Mm,
has high blood pressure with complications that are building up.
mm, mm, mm.
You sure it's not the witches in our village that is really
This
working
one there,
against us?
this one there, you can bind them and it won't be bound though. You only bound the blood pressure.
It will actually lead your pressure to go up more.
It increase the blood pressure. You're gonna think about the witches and increase the blood pressure.
Oh my goodness. All right. Let's see what else is up there. Okay. Let's see if we have the third question on our talk
So
today
one
is
thing I wanted to mention, you talked
Mhm,
about, and this goes to my male counterparts.
mhm.
So unfortunately, one of the ways that a man might go to the doctor will be because of erectile dysfunction, and that can be as a result of high blood pressure. But he doesn't care about the blood pressure. All he cares is that he's going there for Cialis and then also for Viagra. But then there is a reason he comes to you, oh, help me, doc.
Mhm.
But then there is an underlying reason. So one of the I forgot to talk about that also. One of the things. So for my fathers out there, my brothers out there, one of the things for untreated hypertension that it can affect you is that erectile dysfunction is also one of the complications of high blood pressure.
My goodness, my goodness, my goodness.
So I'm talking directly to you. I'm looking at you, talking to you. So if you know you have that going on, there is a reason for it.
There
Go
is a
get checked
reason.
out.
Go get
Hmm.
checked out, definitely.
Yeah.
And the sad thing is, before they actually goes to the extent of showing the erectile dysfunction, other things may have gone apart
Have
from the
happened
erectile
already. Yes.
dysfunction. They may have already
Yes.
gotten to where their heart is already hypertrophied,
Yeah.
And
Yeah.
then they probably have, blockade somewhere else, like the kidney you mentioned.
The kidney. Yeah.
All those things may have been affected. The only
Mini
thing that
mini
sends them to the
strokes,
strokes, mini
mini
strokes, yeah.
strokes that they are not aware of. Yeah.
Yeah.
Tiny strokes that didn't lead to a major deficit, but that they are not aware of.
And they are aware of. This is serious stuff we are talking about. This is serious stuff. Now I know we may have to find another time to comment on this, because some people also say that when they got ED and they went to see their doctors, things are not even working anymore. Or take it back. When they have hypertension and they went to see their doctors, now erectile dysfunction is creeping in.
Yeah.
So they are blaming. They are not taking their blood. As a matter of fact, I have first-hand knowledge of people who have told me that because of their treatment of hypertension, their manhood is not working as good, and so they refuse to take their blood pressure medications as men. We may have to
So,
come to a show about it, but just a little bit
yeah.
on that.
But let me talk a little bit about this.
Yeah.
So this is what I tell my patients, because I have patients who come to me. Let's say you prescribe a beta blocker, metoprolol or something, and then that can lead to erectile dysfunction. But then I tell them, come and tell me, because there's so many other medications that we could use. It's a matter of finding something that works for you. So maybe you come off and you tell me that I don't want a medication that will make me pee a lot. So then we use something that doesn't, but then it can affect you in terms of the erectile dysfunction. Go talk to your doctor. There's so many other medications that he can use that you will not have that. So if you don't get anything from me today, just go talk to your prescriber. There are many other medications that we can use that your blood pressure can be controlled. At the same time, that side effect of erectile dysfunction will not be as huge or as prevalent.
My goodness, that's hope for a lot of men. My goodness. That is really important. That is really important, because a lot of people are not taking their medications and they are
Yeah.
scared to tell their doctors,
Yeah.
and they just stop taking it because they think that there's no solution, there's no way out there. So it's good to know that there are other medications that can be switched, onto, which may not have those side effects, and
Yes.
so that you can have both things. You can eat your cake and have it,
Yes.
as they say,
And
right?
have it. Yes. Absolutely.
So, what I would like to ask is, I know that most men wouldn't go for their annuals. They will ignore certain symptoms. They will ignore a lot of things, like you're talking about mild stroke or weakness or anything. But when they hit down there, when they can't perform, that's when they want to follow up. So, as a doctor, if such a person comes to your office, how do you go about it? Because end of the day, it's not just they are not able to perform as men, but there are other things that are happening to them. And because they feel like they are not sick, they don't follow up with their annuals or do the basic things. When they come, do you really extend it or make it like, oh, you have to take care of other part of your life, except not just the ED that you are experiencing?
So every patient is different. So this is what I'll say. I'm a physician. I have a primary care doctor. I don't treat myself. Okay. So it is very important that if you are out there, and even if you don't have insurance, there are free clinics, especially for us in Connecticut. I used to volunteer at a Malta van. So there is a Catholic Charities. It was called the Malta van. It's free. You can go and then you can see a doctor. So you should have a primary care doctor, especially you work, you have insurance. For now, a lot of people are more insured than before. So you should see a doctor. Secondly, what I would say to it is that when the patient comes, I try to meet them halfway. It's more of a compromise. You want this is your priority, but this is my priority as your physician. So sometimes you meet there halfway. Depending on certain things, I'll tell them that I might not be able to prescribe this medication for you right now. So this is what we need to do. Set a target and then be able to do that. So it's not one size fits all. It depends on the patient. The most important thing is that that patient will return to me. That patient will keep coming. That's the most important thing. Because at the end of the day, we are here to help. And as much as I can get him to come back, that means a lot more to me than just saying that, hey, I put my foot down, this is what we have to do. Because everyone is different. Someone will come and you tell them, hey, this is important. They're like, okay, doc, I got it. What do I need to do? Right? Said, I'm not just worried about erectile dysfunction. I'm worried about you possibly getting a stroke. I'm worried about your kidneys. I'm worried about your heart. You'll be like, okay, what do I need to do? And somebody else will be like, yeah, whatever, you're going to end up. It's like we're going to, no matter what, we're all going to die. So why even bother? So it really depends on the patient.
Okay, thank you.
Powerful, powerful. My goodness, my goodness. All right, I guess this the erectile dysfunction thing we have to literally come back to it. Yeah,
And
I
talk
think
about it. Yeah, it,
we have
it,
to
it needs its own multiple shows.
yes, yes, we have to really do it because I mean it's so linked to the hypertension, especially with men, that we need to
Yeah,
actually focus on it because I've heard it. I mean,
yeah,
in our practice, people come and they say the same thing. So I think there's got to be a communication around that subject as far as hypertension treatment is concerned, so that we can get the people, like you saying, confident enough to come, even if that's all they want. At least if you can help them with that, next time maybe if you want to deal with their pressure, they will listen to you. So that's a good
yeah.
way of going about it. I think this question has been probably already answered. So could you explain the link between high blood pressure, heart disease, and stroke? I
Yeah,
think you already. Yeah.
yeah. I talked about that. Yeah, I talked about that. Yes.
All right. Anything to add to that, or we can move forward on that?
No, I think we can, and I think as we talk more, some of these things will come back.
We'll come back up. Okay. All right. So with that, the next question is, why is hypertension often undiagnosed until serious damage occurs?
And there are multiple factors that lead to this. One of them, as we talked about, unfortunately, let's say for our population, lack of insurance, they don't want to go to a doctor. They're walking around with high blood pressure and they don't know it. So socioeconomic, it's one of the elephants in the room, and unfortunately, that is what you see. If someone is insured and then they have a decent insurance, they are more likely to seek care than when they are not. So as much as we don't want to brush it off, it plays a huge role in hypertension being diagnosed late. Secondly, also is that we talked about it being a silent killer. We talked about it, you walking around with it for a while and not even know. When some people know, they will take action. But unfortunately, they are walking around and they don't know. And that means that those people are not, they are not paying attention to their health. So at the end of the day, you have to pay attention. High
Mm.
blood pressure starts up as you get older, especially as you get older, high blood pressure creeps up. Just creeps. It doesn't even start like boom. It creeps, 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 creeps. You hit your 40s, you hit your 50s, then now it's a big deal. So that's the other thing. So if you are on here, as if you're in your 40s, in your 50s, you definitely and above, you need to have your blood pressure checked. If you haven't checked your blood pressure, walking around, haven't checked your blood pressure in a month, in a year, you have to check it. Just randomly check it. And I think that will be helpful. So those are some of the things I talked about, economic. And if someone has other medical issues and they go to the doctor, then they are most likely going to be diagnosed with that too. So one of the first things you do when you go to a clinic is to have your blood pressure checked. Just basic vitals is taken. So there are multiple things, and then I wanna talk about this because for our people, my people who thinks that herbal medicine can solve this problem.
Oh
If
my
if
goodness.
the
Oh my goodness.
And I'm going to talk about prekese. I don't know what we call prekese in English, Dr. Oting. So
No.
so so people know they have an issue, but then they are trying to do it with quote unquote herbal medicine. Yes, herbal medicine has some role to play, but it's not going to take your blood pressure from 140 to 120. It's not taking you from 160 to 110. It's not taking you from 180. to 110. It's not going to happen. So some people know they have it, they know that there is some problem with it, but then they are not actively seeking help because they think that tablets are not they are chemicals and they would rather go the natural way. All right. So that is the other thing. And if you have a family history, your mom had high blood pressure, your dad had high blood pressure, your aunt had high blood pressure, your great grandfather had you turn left and right, they had a high blood pressure. My goodness, you need to have yourself checked. Most likely you're carrying that gene as well.
Wow. Wow. That is, I like that you brought that issue of those natural medicine stuff. I think was it last 2 weeks or so where we were talking about something like that. Like somebody stayed home and thought that, was it last week?
Last week, yeah.
Yeah. Somebody stayed home and said that their blood pressure is on point. They were drinking this solution of Percocet or whatever it is in English, and they were fine. But they had one chance of stopping by the nurse's station to check, and they had to admit this person right there
Yeah,
because he was a walking stroke. He was
yeah,
a walking heart attack right
yeah,
there. So people who are watching this from every place on the planet, I know in the US we don't do that as much, but still, even here, some people still get some stuff
yeah.
shipped to them,
Yes,
and they're like, oh,
yes,
this is
yes.
natural, this is healthier.
It is
It's
not.
not
Yeah,
like that. So I'm
yeah,
really happy that you brought that up because a lot of people are walking around telling themselves that they are treated because they are taking some stuff. And Doc, one thing that has come now that I've seen, even on the radio, national radios in those places, they are accepted. People are giving
yeah.
airtime and they are selling these things which have
Yes,
not been
yes.
tested, in people, and they are
No.
making money off of them, and people trust them because they speak of them as if it's their
Fluently.
best. So I don't know what else to say, but that is a
If
really good point. Uh-huh.
if Percocet worked, Glasgow Smith Line, they will buy acres of land and grow
And
Percocet
go
and extract
and
whatever.
extract
They will own all the Percocet in the world.
in the world.
All
Definitely.
these pharmaceuticals will own all the Percocet in the world and extract whatever it is that it's in there to 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 get them to you. So please, we have to put that thing aside. And I say this, some God gave man the ability to help man too.
Okay. Wow.
My goodness. My goodness. My goodness. Wow. I just wish we could go on and on and on. But in the interest of time, I know you've had a busy day already. So let's move on to our next question. If you want to read that.
Yeah. Please discuss the effects of hypertension on the brain and dementia.
I
Yeah.
think you've said a little bit
So
about it, but
Not
we
dementia.
yeah,
should yeah.
we talked about stroke. We
Mhm.
talked about stroke, and then the two kinds of stroke. Unfortunately, when right now I have a patient who was driving in the morning. He was going to work. He had high blood pressure that was not treated. He was going to work, and then all of a sudden started having a headache. So he got out of his car, and then on the highway, he got off his car late on the side of the road. Somebody saw him, call 911. By the time he went, his blood pressure was very high, and he had a bleed. So they had to take him to the operating room, take some of the scar away to allow for all that pressure. So I have him right now. I'm taking care of him right now, as a result of untreated high blood pressure. So
Mm.
that's I talked about the bleed, I talked about the blockage, and I talked about the blood vessels, which it gets modified, and that leads to further blockage, and then you're gonna have an issue with blood not being able to get to the brain. Now I talked about mini strokes. So there's something we call vascular dementia,
Mhm.
and that is as a result of having all high blood pressure, and over time the blood vessels getting modified. That leads to what we call dementia. Then that the neurons or the brain cells, they don't work as well. So you're in your 60s and now you're forgetting things. Yeah, being forgetful is part of aging, but not to that extent. And unfortunately, that can lead to dementia, and you not being able to recognize your family members. Eventually, it gets to that. You know, they get out, they are driving, they go to Walmart, and they can't find their way back home. So those are some of the things that you see that can happen. So vascular dementia is multiple, all those tiny blood vessels get damaged over time, get damaged over time, get damaged over time. And this is a slow process. It's not something that happens overnight. And then that is what can lead to dementia.
Wow. Well, this is not something that I've actually thought about. So it's important for breaking that down for us. Vascular. So if you even don't get full blown stroke where everybody will pick
Yes.
you up, you are eventually going to get some kind of a brain issue with
Yeah.
hypertension if it's not
Yeah.
treated. Wow,
Yeah.
that is
The
huge.
bottom line is you can't walk away, you can't walk around with high blood pressure and not get a complication. I'm yet
I
to
like
meet
that.
somebody
I like that.
who's had high blood pressure for a while and not get a complication from it. One way or the other, you get something.
One way or the other, whether you see it or you don't, it will happen.
You don't see it, it's going to happen. So if you have high blood pressure, you're going to get something. It's a matter of when. It's
It's
not
much
if,
of
it's when.
when, unless you treat it, right? If you treat it, though, you're good.
Correct.
Okay,
Yes. Yes.
all right.
So let
And you
me so
want
let me if you have untreated high blood pressure,
good.
it's just a matter of time. It's not if, it's when.
It's
Fine.
when. My goodness. Have any follow up or can we go?
Okay.
Wow. This is getting hard. All right. Now, our next question is: tell us your experience. Yes, I read this about you. Your experience in specialized care, which you have, I think you alluded a little bit to it, for stroke and trauma patients, especially in relation to hypertension. I think you mentioned one patient. Is that a common occurrence that people that you have to take care of are coming through because of complications of hypertension?
Unfortunately, yes.
Wow.
Unfortunately, yes. So I do a lot of post-stroke care. So that's why I was saying that I have seen and I have witnessed, and not only witnessed, I have treated people with high blood pressure complications, be it heart failure, be it stroke, multiple strokes. Right now, as I'm talking to you, I am the medical director of 28 bed unit, and at least I have between 8 to 10 of them that is related to high blood pressure complications over
Wow.
there, short of trauma or spinal cord injury or other things that happen to them or post-surgical complications. But it is not uncommon that when I'm called or when I'm reviewing patients for admission, stroke is it's almost like a daily basis, or some form of high blood pressure complication, some form of cardiovascular complication. It's always part of their past medical history. So I take care of people who've had really bad strokes, people who can move any part of one side of their body. We call that hemiplegia. I take care of people like that. I take care of people who, as a result of stroke, they have weakness. So there are things that they can do. So they come to me. In the beginning, they can't move anything. We have to use a lift to get out of bed. We have to have somebody help them. And I'm not trying to paint a dire picture, but that is what happens. It happens that you're going to have people take care of you. And as a result of that, they're in a hospital for a while. So that is what we do, trying to get them control their blood pressure, number one, and number two, hopefully stop any further strokes from happening. And secondly, also try to get them as strong as possible. Hopefully that they go home with some regain of function. But unfortunately, yes, I do see the worst of it.
Wow.
Wow.
Wow. Come on. That's a sad case. That's a sad case. Yeah.
Yeah, the mild ones don't come to me, but I see the worst ones.
The worst ones. Wow.
Yeah.
Now, as a follow up, among that population, do you see more of the older ones, or you see a little bit of the younger ones involved, like people in their 40s and 60s? What's the age breakdown?
Yeah, mostly it's older patients. Mostly 60s, 70s, 80s. But but let me put it this way. Unfortunately, lately we've seen a little bit more young people. coming in their 40s, coming in with blood pressure complications. So unfortunately, I'll say that, I remember the other time we are talking about, and it's like, my God, why are we having 40s and 50s? So
Yeah.
unfortunately, as our lifestyle gets more sedentary, I think that there is an uptick of that, and I've seen that myself.
Wow. 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 Well, viewers, if you are watching and you are not taking care of your pressure, this is first-hand experience. He's not talking about what somebody has done. This is what he does. Doc, this is what you do and they pay you, right? You take care of those people?
Yep, I'm
So,
paid for this for sure.
so this is truth. This is truth. You can't be that. And that's why we wanted to talk to somebody already taking care of people who have experienced this. And so if you are thinking that it's far from you, watch out. And we don't want to get there. And hopefully, as we already alluded to, some of the things you can pray your way out. Some people are using, spiritual means to conquer physical battles. It doesn't work like that. And you can't just, wish that it's not wish your way out. You can't just ignore it and hope that because you ignored it, it's also going to ignore you. It's going to be, even if it doesn't get you in your early ages, like your 30s, 40s, 50s, 60s, it may happen. And that is when you are actually going to be ready for retirement to enjoy your grandkids and your hard work all those years. You don't want to be paralyzed or become, somebody who cannot do anything. So I'm happy that we got you to speak to us on this. And hopefully, people who are watching will take care of themselves. And if you know somebody who is not, you're a spouse of a husband, of a husband or a wife, and they are not doing right by their pressure, they're not taking their medications. I hope you can share this with them and talk to them about the consequences of what can happen. Before we move, you have any follow up on that? All right, I think we have a few more questions, and I'll have you read that over.
Okay. How does hypertension affect the kidneys, leading to CKD?
Yeah, I think
I
he
think
also.
he said
Okay.
it, but I don't.
I think.
Yeah, we talked a little bit about that in regards to the different stages, and then eventually that can lead to dialysis because the unfortunately I know of some people who had high blood pressure, weren't taking their medications, and then eventually they ended up on dialysis. That's not where you want to get to. It's not fun going somewhere 3 times a week and spending 4 hours in a chair 3 times a week to be dialyzed. And then not only that, one of the difficulty things, you can't just get up and travel. It's not fun. If you're traveling, you have to think about, okay, why am I going to get my dialysis? Why am I going to do this? It's so preventable. That's what I'm trying to say. The bottom line and the main message I'm trying to get across to what is that we don't have to get to this stage. We don't have to get to this stage. Wherever you are, you can be treated for the progression of it to be halted. Wherever you are. If you are CKD1, you can be treated. CKD2, you can be treated. So that if you don't get anything from me, please remember that going to get treated will halt the progression and it will do a huge, huge, huge good to your body as well.
Wow.
Wow, my goodness. I like it when you end it with positive because there could be some sad stuff.
Yeah, yeah,
CKD, yeah.
yeah.
And I mean, when you mentioned, I remember we know. I think you probably know. We know at least two people in our own community that are on dialysis just because of hypertension. At least they told me that it was due to untreated hypertension, and they are dealing with hypertension. You can't take a vacation like he's saying because you have to find out where you can go for dialysis.
Yeah, yeah,
And it's hard. And sometimes even that will not be enough. They may need to get a kidney transplant if you don't have anybody.
yeah,
What's going
yeah.
to happen? And like he's saying, the key thing is if you could prevent it, why don't you do that?
Yeah.
So that is very, very important. Now we got another on here another comment, brother Dumaku Maxwell says that good job. I think he's telling you, Doc, it's not us. We are just asking the questions. All right. Any other
Yeah.
follow?
So I think what I would add right now is we can see the dangers of your blood pressure not being controlled, right? And you
Yes.
hear these people selling some herbs, like they are so passionate about what they're talking about.
Yeah.
You don't know their credentials. You don't know where the source of whatever they are going to put together is from. And some people tend to trust these people over the Western medication. We sell medication. So when you say they're like, oh, yeah, you want to keep your job. But we have to understand that these medications, I know there are side effects, all right. But like last time we were talking about, if you compare the benefits
This is the risk.
versus the risk, you know,
Yes.
it's so huge. You are going
Yes.
to lose your memory, dementia,
Yes.
and you can't even recognize your kids, and you don't remember their names, and you don't know where you live. It's so huge. It
That-
can affect
Yeah.
your kidneys. It's so like we shouldn't take it lightly at all.
That if you're lucky to live to age 60 and
to
over
have
to see
that.
those.
Yeah.
What
Yeah.
if you die of
Yeah.
heart attack or
And stroke.
a stroke
Yeah.
before that? Oh
Yeah.
my
And
goodness.
your
Yeah.
quality of life is so
Yes.
minimal that you
Yes.
can't do stuff for yourself. All the money
No.
that you're saving for retirement, somebody is going to take it and
Just
take
gonna
care of
enjoy
you.
it. Absolutely.
We want to travel. We want to have
Yeah.
quality of life at the latter
Yes.
stage of life. So you don't want to be
Yes.
paralyzed or being bedridden and you can't live your life. So this is
Yeah.
huge that we all have to take it serious and try and know our numbers and control the pressure if we've been diagnosed than to throw it
One of the
somewhere and
things-
just go for.
Yeah. One of the things I tell people is millions of people, possibly, I mean, I couldn't say billion, but millions of people have taken these medications. We've been using them for decades. We know them. I know them very well. I know what to expect. And if that happens, there are ways that we get around it. I'm not saying there's side effects, but it's tried, true, and tested.
And tested.
And millions of lives have been saved. People have lived longer because of these medications. So to people who are all skeptical about that, I'm saying this: millions have taken it. We know what to expect. We know what to do with it. If you have any issues with it, yes, I'm not saying that there's no side effect, but compared to the benefits, it is very minuscule. And there are a lot of safe medications that you can take that have been used for 30, 40, 50 years and taken by millions of people.
Definitely. I like that. I like that. They are tried and tested.
Tried and
You can
tested.
beat, regular medicine, Western medicine. Some people are just against the word Western, so they get
Yes.
just say that you can beat tested, tried, and studied medicine. That's what it is.
Yeah.
That's what it
Yeah.
is. You can compare it to somebody who makes some concoction of herbs and say that it works. They have no studies, no clinical trials. Even the dosing amount,
dose.
they don't even know
Yes.
how much toxic it
No.
is when you go.
No.
It's just drinking stuff and dying off of it. So we all have testimonials of people who have taken some. As a matter of fact, I knew somebody who almost touched, was it his kidney?
Kidneys.
Yeah. This person used to be a member of our church. He's no longer here, and the fact that they confided in us, we told them stop it right away and go get checked. So if you are taking anything that is not approved by any physician or regular medicine, please be careful. We are not here to destroy people's business, but we just want you to do the right thing. That's all we're about, and that's what doctor is saying.
Yeah, and sometimes too, when they are shipping it to the States, they make it special.
Of course,
because you are paying the big bucks. And you can see that the
Double
dose will be high.
dosed.
Yes, because you are
they'll
paying
give you
them
the
a lot
high
of money.
dose, because if you say it's not working, you buy again. And that high dose is going to touch your liver,
Yeah.
it's going to touch your kidneys,
Yeah.
and do all those damage.
You
Yeah,
have to be careful. Yeah.
very, very careful. All right, let's see if we have any other questions here. Next question is, does having uncontrolled diabetes make matters worse for somebody with hypertension? Doc?
Absolutely. So one of the things with, unfortunately, with all these comorbid conditions is that some of them, they go together. So obesity, high blood pressure, diabetes, high cholesterol, you see that. So blood, your blood sugars not controlled definitely has a correlation with high blood pressure. So it makes it worse. So it's just that sometimes I find it hard to believe that people don't care about what they put in their body.
Mm.
I You are what you eat. I find that you go and then somebody is buying this burger with a side of that big high C, and then I don't get it.
Get it?
Like I don't I look I'm not trying to judge anybody, but then I look and I'm like, my goodness, you should not be buying this. You should not be eating this. So unfortunately, all those bad, or not bad, all those poor diets, for whatever reason, this is what it comes with. It comes with high blood pressure because of high salt. It comes with high cholesterol because there's a lot of fat in them. And then most of them have really poor in terms of the refined food and the raising your blood glucose. So unfortunately, these things usually they come together. I'm not saying that if you have high blood pressure, you have diabetes. No, don't get me wrong. But definitely, that's something that if you go to your doctor, yeah, this is one of the things that we check and make sure. But these things usually travel together: high blood pressure and high cholesterol. Because of sometimes if it's not genetic, some people, I've had patients who come to me, they will work out, they eat healthy, they do everything, but they still have high blood pressure. In those situations, those are genetic. There's nothing you can do about it, but you treat it. But there are some people who it's pretty because of poor choices that they make. So yes, having uncontrolled blood pressure can definitely make your having uncontrolled diabetes can make your blood pressure worse.
All right, all right, all right. Well, we just want to stress that because we mentioned that in our diabetes series that there's actually studies out there too that are also postulating that high sugar, high glucose, hyperglycemia,
Yes.
basically leads to blood pressure going up because of uric
Yeah.
acid conversion and some other scientific things that
Yes. 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 So when they come to the hospital, usually when they have like diabetic ketoacidosis or one of them that we call HHNK, usually their blood pressure is high.
type.
Usually it is high. I'm yet to find one who walked in there with a normal blood pressure.
Wow, wow, wow. But the key is if you get them all controlled, you are fine, right, doc?
Yes,
You
yes, yes.
control your
So
blood sugar, you
all
control your blood glucose. Mhm.
absolutely. The reason for this show, the reason why we are talking about this is that it is treatable, as we said from the beginning.
Mm,
It is
mm,
treatable. The
mm.
reason we are on here is to inform you, is to educate you. You are your own best doctor. That's what I tell my patients.
I
If
like
we
that.
educate you, then you can take care of yourself.
Yeah,
So
you are
my
your
job,
own doctor. Mhm.
yeah, you are your own best doctor. I tell
Best
my
doctor.
patients that all the time. And my job is to explain things to them for them to get it. And I believe that when they get it, then they can take charge. Because
Mm.
sometimes he doesn't know why he's doing what he's doing. If I can let them know why, then I tell them, you are your own best doctor. You know why this, why that, why that. So that's the reason that we are here. We are here so that we educate you. We are here so that some of the things that you are thinking of, hopefully you put them on the shelf. And we are here to tell you that go get help, go get treated. And it is very, very treatable.
Wow. Good, 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 good. Any more follow up? All right. So let's see what is up next. I don't know if we have any other questions. Okay, we have another question. And this question is what can we do to monitor or minimize the effects of hypertension before they become serious health issues? I know we've been talking about all the bad stuff that hypertension has gotten. Doc, what can we do? People who are watching, what can they do?
Yeah. So there is a lot that we can do. Now, one of the things is your diet. So
Mm,
what I would say is that number one, please, blood pressure monitor is not expensive. It is not expensive at all. If you're in the US, I think that you can afford, you can spare between 20, 30, maximum $40 to get a blood pressure monitor. If you're here and you're an adult, yeah, if you're in your 20s and then you don't want to do that, I can understand that. but 30s, 40s, going up, I think that you should have it. Check your blood pressure. Have it at home, or if someone else has it, just check your blood pressure. Try to check your blood pressure at least once or twice a year. I'm not making this complicated. Check your blood pressure at least once or twice a year. And knowing that's the only way you know is if you check your blood pressure. Or some of these complications is what would take you to the hospital before we find out. All right. So that is one of the things that we can do. And I think that knowing is the most important thing. Secondly, is diet. You know, we've heard about the DASH diet, right? We say that the dietary approach to stop hypertension. Yeah, that's DASH. So the DASH diet, in terms of making sure that you're eating low sodium diet, things that are high in salt, directly correlates with high blood pressure. If you eat a lot of salt, you're in trouble. If you have the genes that your kidneys are good at getting rid of the salt and you don't have blood pressure, then good for you. But high salt diet, and you know that our people love spices, and those with those spices, the adobo has to go into the meat very, very well, you know. And we forget that salt is what takes the spices into the meat. Basically, they're salt laden. That's what they are. So high salt diet, doing bringing down your salt. There's a clear correlation. Studies have been done. Patients with high blood pressure, if they decrease their salt intake, their blood pressure reduces. That's not the other thing. The third thing we can do also is to exercise. Just any form of exercise. It doesn't have to be complicated. You just going for a walk, you doing something out of the norm, out of your basal, just your basal or your sedentary lifestyle. That also helps to reduce blood pressure. And weight loss, clearly, multiple studies have shown weight loss. Even people, this is pretty interesting. People who lost weight and did not even change their diet, in terms of high salt intake, their blood pressure came down. So that's some of the studies that is out there. So losing weight also helps with blood pressure. So these are the main things we can do. You being aware that, hey, this thing can happen to me. This thing is there. Let me just make modifications. I'm not 18 anymore. I'm not 21 anymore. But at this point, let me just make modifications. I think we'll go a long way.
Oh my God. Come on.
Yes. So, Doc, if you buy the monitor at home, then you take your blood pressure and you realize that it's high, what do you do? What's the suggestion?
My suggestion is definitely find a doctor. If you don't have a doctor, find a doctor. Find a primary care doctor and go to them. If you're uninsured, as I said, there are most free clinics. If you just Google free clinics, you find quite a bit of them that you can go to them and say, hey, but one thing, the wrist blood pressure monitors are not good. I would not recommend it. The readings are not accurate at all. You could have a false sense of normal blood pressure. You could have a false sense of that. So the wrist one, I don't recommend it. Just get any blood pressure monitor that will go over your arm. You know, like your bicep area. Any of these are decent, and they have gotten better over time. And most of the time, they'll correlate with the ones they use at the doctor's office. So if you get one and then you check your blood pressure and you realize your blood pressure is high, go see a doctor. I have to say that before we diagnose high blood pressure, we are very mindful of it. If you walk in and you're 160 over 120, I would diagnose you with high blood pressure. You are going on medication. But if you walk in 139, 140, we don't just jump on it right away. What we do is that we'll have you come back, check it at home. So if at home you are checking your blood pressure and consistently you're above 130s, 140s, especially with multiple readings at home, most likely you have high blood pressure. And you should, if with that information, your doctor can start you on something. Because sometimes some people in the doctor's office, it looks normal, but at home, their blood pressure is high. So we know we have the Y code effect. There are people who are opposite of the Y code effect also. So at home, their blood pressure is high, but when they are at the doctor's office, it looks normal. It's like 129, the doctor's like, I think this is okay. But then at home consistently, it is high. But there are certain things that I want to get across. So if you're going to check your blood pressure, get in bed, lie in bed, wait for about 5 minutes. Wait for about 5 minutes. One of the times that you can have a good reading is maybe right before you go to bed. You lie down in bed, you wait for 5 minutes, your legs are not crossed, stuff like that, sitting down with your legs crossed. No, just if you lie down and you can do that, you wait for 5 minutes, maybe 15 minutes for sure, you're laying down, then you check that pressure. If you check it on the left arm, you can check it on the right arm also. We always want to go with a higher number. So if you check on the right and it's like 140, you check on the left and it's like 128. Yay, 120. No, the 140 is likely what is going on there. Okay, so definitely wait, check it. Maybe in the morning when you wake up, to one of the first things you can do before you get out of bed, just check your blood pressure. So those are what we call good blood pressure readings. So I don't want you to go there, walk around, yell, then go check it and 150. It is normal that when we do stuff, our blood pressure goes up. But then what we are asking for is, what is your blood pressure at rest? What is your blood pressure at rest? So across the day, your blood pressure changes. But when you are at rest and then you check it, and if it's anywhere, it's high. So that information is very helpful to your doctor and it can help. So that's a good way of checking your blood pressure. It's just waiting 5 minutes and then you get a good reading. So I want us to get that across to people so that they have a good practice in regards to checking their blood pressure.
Thank you so much. My goodness. Now I see at least 7 people on the live, but only 5 thumbs up. The remainder, what are you doing? Give us some likes, some thumbs up, and all that good stuff. So that the video will go far and have other people watch it. Remember, we do this just to help people, and so if you can tap the like or share, you are also helping. Doc is spending his time here, but you will be adding to his voice just by sharing it. That's how we all solve these issues together. All right.
Yeah, one more question. So, Doc, if somebody is put on maybe 3 different medications, outwardly, like for them, their diet is okay, but they realize that it's still not well controlled, what else can they do?
Definitely, there are so many things that we do in that situation. So if there are, so one of the good things that lately pharmaceutical companies are doing also to make it easier for people to take medications is do combination medications, right? So you take 2 medications, you combine them into one so that you're not taking multiple medications. But there's still a lot we can do in regards to that. Number one is that we ask ourselves, is this something we call resistant hypertension? Is something else driving this blood pressure? So that is that some people walk around and they are making certain hormones. I'll just make it simple. They are making certain hormones that is still driving their blood pressure. So we ask that question, and then there are other things we can do to try to find that answer and solve that problem. So that is number one. So your doctor, and also I want us to advocate for ourselves. If your doctor is brushing you off and he's not listening to you, find another doctor. Okay, find another doctor, because if the blood pressure is still really high, doctor is like, yeah, no, find somebody who would listen to you. So you can go to a doctor and say, hey, I'm checking it at home, and it's still pretty high. There are multiple things we can do. We can try to find out, is there something that is something driving this blood pressure? And if it's so, what is it? And then trying to find it. And there are other medications that we can switch around, combinations that do work better than maybe what you are on. And sometimes too, so most patients, one of the problems we have is that they don't take their medications consistently. So they come and the doctor keeps tacking on medications. And you know how I find out about those people? They come to the hospital, I put them on all these medicines, and their blood pressure drops. And I'm like, if you're taking that home, you'll be having problems. So usually when they come and I put them on all these medications, oh, you're on this, you're on this, you're on this. Okay, let's restart it. I put them on it and then it drops. Their blood pressure is low. Then right away, and 99% of the time, they are not
Yeah.
faithful
Take
with
it.
taking their medications. So people don't take it, and then the doctors keep adding. One of the things I want to say is, if let's say that 6 days out of the week you're able to take it, good for you.
Mm-hmm.
Okay, you forget it, that's fine. Just start taking it again.
Mm-hmm.
Don't make it complicated. Maybe you forget here and there. That's okay, but do not make it complicated. Just take it when you remember it. Take it, take it, take it. So that's what I would say. There's more to it if your blood pressure is not controlled for us to look into.
Wow, my
Thank you.
goodness, my goodness, my goodness. That was deep. And another thing is, especially with the technology now, you can set reminders on your phone. We set alarm to
Yes,
wake up early
yes,
in the morning. People don't know
yes,
you can set the same
yes,
alarm to remind you every morning or every evening to take your medication. You could do
yes,
that, and
yes,
that will help you.
yes,
That was very
yes.
good. All right, let's see if we have any other question on the line. Oh, this is where we ask people to bring their comments and if anybody has questions and stuff like that before we make Doctor give his final thoughts. So if anybody is joining and you have a question, this is the time for you. You can put it on. I know you can put it on if you watch later after the live show. You could also put a question or comment on. But if you're on the live right now and you think there's a question that needs to be answered, you can put it on in the chat and hopefully we will see it and have Doctor answer it. But before we allow Doctor to say his final thought, I'm just going to also see if there's anything else we can also add to what.
One go.
Yeah. So, Doc, for people, I think it may have come up. People who have been on these medications and it's not working. Um, if people are not doing their exercise, do you think that that could be a component, or should I say, if you are just doing diet and medicine, and the medicine is not
Yeah.
working, you are taking it religiously, then maybe don't you think adding the exercise would be a thing to do?
Yeah, absolutely. This is what I say. If you have high blood pressure, you go get diagnosed. You're put on three medications. Exercise and diet changes, that medication can come down to even one.
Mm.
Okay. That medication can be reduced over time with your lifestyle modification because in itself will bring that blood pressure down and you might end up on only one medication and that's all you need. So exercising and diet changes definitely leads to less medications.
Wow. Wow, that is good. That is good. So we have a way of controlling certain things. Now, my other question is I will ask this for an unknown person. Can hypertension be cured? As people ask you, can hypertension be cured? What do you have to say about it?
Yeah, so I've had patients who started off, you put them on amlodipine, 5 milligrams, 10 milligrams, and they make lifestyle changes. Some of them is as simple as alcohol consumption, and
Mm.
then they make lifestyle changes, and then their blood pressure is much better, much normal, that we take them off the medications. So in that situation, I'm not saying that they are cured, but usually it was some as a result of something that they were doing.
Mhm.
If your high blood pressure is more genetic, then I'm going to go out on a limb and say that it is less likely that it will be cured. So you are one of those that might need to be on medications for the rest of your life. And that's why I say that we don't take it lightly when we diagnose high blood pressure because we know that when we put you on medications, it's probably going to be a lifelong treatment. So because we don't cure it, we manage it.
Manage.
So
I
blood
like
pressure
that.
is managed,
I
not
like that.
cured. So that's one of the things about high blood pressure. But usually, if obesity, alcohol drinking, bad diet, they stop these things. They start exercising. You start them on something. Eventually, we can take them off of it.
Wow. Wow. Like, yeah,
Yeah, so if you hear the people selling their own thing on radio and they're saying that this kills it,
They can
come
cure.
get
Yeah,
come
my
get it, it can
goodness, they
kill
have no
you.
clue.
I have testimonies, I have people, and people will come and testify and all that. If you don't believe it, or if you find yourself using such medication, you have to have the monitor. Just monitor it.
Yes.
If you are taking
Yes.
it, just
Yes.
monitor it. It should tell
Yes.
you
Yes.
that it's
Yes.
not gone. It's just
You
maybe
you realize if
subsiding,
it's not
or
working.
it's not working. So they can
Yeah.
say all that they want to say. You
Absolutely.
are your own good
Yeah.
doctor. You can
Mm-hmm.
check it yourself.
Yeah.
Don't listen to what they're saying. Maybe you listen and you bought it all right, but you have to monitor it and
Yeah.
see for sure whether it's helping you or not. And
Yeah.
like we are saying, the medication that has been tested and well known and tried over time has been shown that it works. So we have to
Yes.
be very careful. I get so worried when I hear people saying it can be cured, come get this one.
Yeah.
And I'm like, oh my
Yeah.
God. I wish people are informed. So you're here with us, you're learning, you're being informed. Take it, be your own good doctor and make the right choices, I would say.
Oh my goodness, that's true. Yeah, that is good. That is good. So I don't think we have any comment, any question coming through yet. So I will give Dr. The final thought to you, and then we will close out the show. What do you have to tell
It's
people who are watching today? Yes.
it's my pleasure being here. I hope you've taken something from today's show, and I believe that you make the changes. But what I want you to walk away with is that high blood pressure is treatable, regardless of where it is. It is treatable. It can be treated, and you can have what I would say a normal life expectancy with high blood pressure. It's treatable. So go get help, go see someone, and do your best in terms of what you can do to change certain habits. Do your best. And but then if your best is not enough, go get help. And it is very, very treatable. It's one of the most treatable things that we have that it should not cause any problems. So that's what I would end the show with.
Thank you so much. My goodness. That was a good time. Mm, my goodness. We have been adequately informed today. And we want to say thank you, Dr. Nathan Nartey. Even though I see you every week, I still have to Google you. Believe it or not. And I was reading about a doc, and I found out in 2018 you actually appeared in the Hartford Business Journal,
Yeah,
Physicians
40 under
40 under
40.
40. Like, and
Yeah.
you didn't say anything for us to celebrate too. Come on, man. That was good. you know in the US we have a lot of doctors and a lot of good ones, so for you to be recognized in that respect is something that needed to be celebrated. I hope your wife at least celebrated it.
She did. She did. She did.
Thank God, we thank God. All right. And
Yeah.
so we just want to say we are proud of you and your wife. Your family has been a very good resource to this channel, and we are hoping that in the future we'll still continue. Right now, a lot of ideas are coming as to the next show that we should have, as you can, as you can even think, the ED and
Yeah.
hypertension thing. We must have
Yeah.
a time to do it, and I'm also going to see if we can get your wife to talk about the effect of hypertension on your eyes. She did a good job with sugar, untreated diabetes on your eyes. And now I think at this
We
point
did the cholesterol too
and
with
she did
her.
a cholesterol also. We need
Yeah.
her also to come for
Hypertension.
hypertension on the eyes, so that we will see that it's not just for your cardiovascular system, but it also affects your eyes. And so, Doc,
Yeah.
thank you so much for your time. We
Sure.
will
My
let you
pleasure.
go and rest a little bit, and hope to see you soon. God bless.
Plus, have a good
God
week.
Have a
bless you
good
all.
week. Thank you so much. All
Sure.
right. So, viewers, we are coming to the end of the show. And I can tell you that I am so excited for being here and seeing and hearing from the horse's own mouth. Sometimes, it's good to have a different perspective so that what we say here may make more sense. You know that what those guys have been saying, that's what actually they want us to know. So, thank to Dr. Nartey for what he has done, for his time on this show. And I'm hoping that you will share with other people who may find benefit. You may not need it, but just click the share and the thumbs up so other people who may need it will find it. And if you need anything from it, you can always go back and watch from the beginning and see if you missed something. Take some notes and also go through our entire channel. I think we had other things that are actually put on there. Let me see. Yeah, just comment and stuff like that, and then hopefully you will be able to find out more about what we are going to do in the future. So I'm hoping that next week we are going to talk about another item on another episode of the hypertension series. But before that, make sure you click the share or go to our channel and watch more videos that we have already done. So next week, what we are talking about is hypertension in the family, understanding the genetic link. Understanding the genetic link. So prepare. We may change the topic depending on if we find somebody to talk about something interesting or not. But otherwise, this is what we are going to talk about. And again, we are thankful for Doctor for coming. So we close off by saying, Beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.
Thank you.
God bless.